Good morning, everyone, and welcome again to our Research Conversations 2020 Futures Research Series webinar via the UPOU networks, brought to you by the Office of the Vice Chancellor for Academic Affairs and the Faculty of Management and Development Studies. To officially and formally open our webinar for this morning, may we invite Dr. Melinda Lomanta, the Vice Chancellor for Academic Affairs.
Thank you, Pepper, and good morning to all. I am here to welcome you to our third webinar under UPOU's Research Conversations 2020. Research Conversations is UPOU's forum geared towards discussion of research methodologies, presentation of research results, sharing of research trends, and conceptualizing researchable topics relevant to open and distance learning and the disciplines. This year's conversations is dubbed as Futures Research. It is one articulation of UPOU's year-long celebration of its 25th year anniversary, as we begin to conceptualize and give meaning to the University of the Future. The series of talks is intended to feature specially identified speakers, recognized in their fields of expertise, who can enlighten us on the so-called futures research. Through this forum, we hope to capacitate our researchers and in the process, enrich our research outputs. We hope to gain better understanding of this distinct group of research approaches, which may include, among others, scenario building, multivariate and trend analysis to predict the future, simulation approaches, decision support systems, and modeling to anticipate future conditions. The topic scheduled for this webinar is Planetary Health, the next research frontier. Our speaker, Dr. Ramon Lorenzo Rosa Ginto, an expert in planetary health, will help us better understand the fine balance between human health and the ecological disruptions that our societal structures engender, and how such impact on the planet and its implications on our health. We look forward to this talk on how this could be studied as the next research frontier. The Office of the Vice Chancellor for Academic Affairs, in partnership with the Faculty of Management and the Development Studies of the UP Open University, is honored to bring this webinar to you. Once again, we welcome your participation. Thank you and good day.
Thank you, Dr. Lomanta. So I know everybody is excited for the discussion and the talk of Dr. Ginto. Let me just remind everyone that we will have a question and answer and an open forum after the talk of Dr. Ginto. So please send in your questions via the chat room at the UPOU networks, So at this point, we are very honored to have our guest speaker for today. He is a Filipino physician and chief planetary doctor of PH Lab, a global think and do tank for advancing the health of both people and the planet. He is the youngest member of the editorial advisory board of the Lancet Planetary Health, the world's first planetary health journal, co-founder of the Emerging Scholars Network of the Planetary Health Alliance, which is headquartered at Harvard University. He is also the advisor to the Forum on Climate Change and Health of the World Innovation Summit for Health based in Qatar, and next generation One Health advisor of the Lancet One Health Commission hosted by University of Oslo. He is also an Obama Foundation Asia Pacific leader and Aspen Institute New Voices Fellow. He recently finished his Doctor of Public Health degree at University of Harvard University, where he investigated the concept of climate smart health systems in coastal municipalities in the Philippines for his dissertation. He previously consulted for various organizations, including the Institute of Tropical Medicine in Antwerp, Belgium, World Bank, World Health Organization, Healthcare Without Harm, International Organization for Migration, Philippines Department of Health, and University of the Philippines, Manila. He has traveled and lectured in nearly 50 countries, published more than 100 articles in scientific journals, books, and popular media, directed and produced short films that communicate the message of planetary healing to the world. Let us all welcome Dr. Ramon Lorenzo Luis Rosa Ginto.
Thank you very much. Thank you for having me, and good morning to everyone here in the Philippines. Good afternoon, good evening for our friends who are watching from other parts of the world. Now let me share my screen. Okay. I hope you can see it now. Great. Okay. So again, it's really my deep privilege to be invited to this webinar series on the next research frontiers, and planetary health is one of the, if not the most exciting, most provocative, most ambitious research agenda that we have currently in the 21st century. And for the next maybe 45 minutes to an hour, I will be giving you a whole survey of these emerging arena for inquiry and action. So this is my outline for this presentation. First, I will give to you, the case for planetary health. Why planetary health in this day and age? And then I will follow it with an introduction to the new discipline. I will provide you with a taste of the frameworks and the key ideas and themes around this new concept of planetary health. And then I will give you a brief survey of some of the major pressing planetary health challenges that we are facing today. And then I will present to you some key ideas and also some updates as to the present situation, but also the future of planetary health research, education, and practice. And then we will close the presentation by reimagining the future of planetary health in the post-COVID world. So I want to start first by remembering and honoring those who have been affected by COVID-19 so far globally, both the victims, those who are sick, those who have died, unfortunately, but also the frontliners, from our healthcare workers to the people working in the streets, making sure there's peace and order, to those who are working in government and business. And indeed, we are in a very unprecedented moment in our history. The whole world now has been paused because of a virus that we cannot even see. And so it really highlights to us the global interconnectedness that we have. And that is why planetary health is so important, a concept, a powerful concept now more than ever before. And of course, the Philippines, our home country, is also very much affected by COVID-19. And I want to honor and remember also those who have been affected, the lives that have been taken, but also those who are sick and those who have even recovered, which provide us a glimmer of hope for the future. And just briefly, thanks to our kind introduction, which mentioned this Think and Do tank that I am currently incubating and establishing here in the Philippines. It's called PH Lab, and it's characterized by these three dichotomies or dualities: global, and local, both in perspective and impact. It's a think and do tank. There's a lot of think tanks already around the world doing a lot of the thinking, but not necessarily translating the ideas into action. And then it's for people and planet. And I think the whole talk that I'm giving today will basically argue why an integrated approach to both the health of people and the planet is so crucial in this century. And then in PH Lab, we have this theory of change, 3D for PH cubed. Sounds very mathematical, but 3D means we diagnose these issues in a very systematic way. We design solutions, whether they're in the form of policy or practice or a product, and we deliver. We make sure that the results benefit communities, real lives, and make a lasting impact on our society. And if we adopt this 3D approach, then we can only hope and we can expect that we can improve the three PHS of PH Lab. First is the Philippines or Philippine health. The second is public health, the people's health. And then finally, planetary health. And this is actually my dream, and I hope that you can support me and work with me and share this vision with me. You know, I just came from the States, as was mentioned a while ago. Silicon Valley is the epicenter of technological innovation. But I think, and I hope, and I envision that the Philippines will be the Silicon Islands of planetary health, the wellspring of lessons and ideas and powerful innovations that will protect the planet's health in the years and decades to come. So now I'm going to the first section of my presentation, which is about, you know, the case for planetary health. Why planetary health in the 21st century? But before we even think about our century, even in the past century, in the 20th century, and this is a very classic pie chart that we in public health are very familiar with. This shows to you the social and environmental production of health and disease. We always think that health is created inside the hospital or the clinic by the doctor or the nurse with the help of a pill or an x-ray machine. But as you can see in the pie chart, only medical care, the medical care system, your hospitals, your clinics, they only contribute to around 20% to health creation and improvement. And you know, the numbers vary depending on the study, but that's the rough estimate, around 20%. But where is health really created, really and truly created? As you can see, more than half of the pie is attributable to societal, social, and environmental factors. A huge chunk can be obtained from human behavior. Do we smoke? Do we eat healthily? Do we exercise? And just a very small portion as well from genetics. And this shows to you that the business of health creation is not and should not be focused and concentrated in the medical care industrial complex. In fact, we always say health is so important to be left to the doctors alone. We need all professions, all disciplines, and all sectors to work together towards health improvement, as now we can see with the situation, with the COVID-19 situation. And also, you know, usually in the classroom, I ask the students, guess who this person is? Guess which historical figure is represented in this graphic, in this illustration. And this is Hippocrates, the Greek physician, the father of Western medicine. And this idea of health emanating not from the healthcare sector, but from the quote unquote non-health sectors, although I would always say every sector is a health sector, it already was espoused and embraced and instructed to us by Hippocrates many millennia ago. In fact, you know, you probably are more aware of the Hippocratic Oath, which we doctors recite when we become full-fledged physicians. But here, there's a lesser known text of Hippocrates entitled Airs, Waters, and Places. And here he was instructing medical students, and I'll not read it verbatim. You know, he was telling us to study the seasons, to study the hot and the cold winds, to examine the properties of water. And later in the text, he was also talking about urbanization, the design of cities, etc. So it's, you know, for Hippocrates, it was already very clear that the physicians of the past, of then, and the physicians of the future will have to be concerned about the social and environmental factors that ultimately drive health and generate disease. And so when I was a young medical student in the UP College of Medicine in Manila, I embraced that mantra, that instruction from Hippocrates early on, and you will see me doing a lot of environmental activities, planting trees, you know, Manila, cleaning the Manila Bay with UP Manila, fellow UP Manila students. When I was chair of the UP Manila University Student Council, we really mobilized the whole university around environmental protection, being really deeply interconnected and linked to the business, the enterprise of healthcare and health creation. And in UP Manila, I actually co-founded the first environment and health organization there. It's called UP One Earth. And I think it was last year when we celebrated our 10th year anniversary. So environmental awareness has become heightened in my campus in UP Manila. And I'm glad UPOU is also having this conversation around planetary health. And then in 2014, there was a commentary in The Lancet, which is a British medical journal, that introduced the idea of expanding the ambit of the health sector from public health, which is the health of people, to planetary health, which is the health of both people and planets. So as you can see, the equation just obtained or gained a new variable, which is the environment. And it's really a recognition of both the gains that we have achieved in public health over the past century. We've added around 25 to 30 years in the average life expectancy of the world, but we have achieved that accomplishment most of the time at the expense of the planet, because that is not taken into account into the equation. And that is why there is a call to really embrace not just human health, but also people's health, and thus planetary health was born. So here you will see it's a shift of mindset from public health to planetary health, because our patients now are not just people, but also the planet as well. Because this is what happened, and I already mentioned to you that, you know, with the gains in life expectancy that we have achieved, we've reduced mortality for many diseases. Child health and maternal health have greatly improved especially over the past 50 years. What happened is we have created different forms of pollution. We have destabilized the climate. We have altered a lot of the natural flows in our ecosystem, whether they're the flow of elements or, you know, even the flow of people, because of technology and transport. We've seen all these demographic shifts. Consumption patterns have been altered over the past century, and all of these are contributing to the global burden of disease. There's an estimate actually that around 25% of the diseases of the planet, of the world, emanate from environmental factors, you know, toxic pollution, air pollution, biodiversity loss, etc. So this is really the backdrop in which planetary health is being conceived and advocated. Anthropogenic change, it's us humans who really affected these changes in the environment, which are now getting back at us and giving us all these new health problems that we're seeing today. So you can see here, there's no other way but up. Everything is going up. CO2 emissions, ocean acidification, our energy use, especially coming from fossil fuels, global deforestation has, for a period of 200 years has really increased. Water use, we're overusing our water resources. They say that maybe the next world war will be about water, not land. And fertilizer use, our addiction to nitrogen and phosphorus, artificial fertilizers for the purpose of agriculture. And because we've altered really the natural configuration of the planet, um, I'm sure this is a very familiar graphic for you for those who study geology. There's this concept of the geologic time scale. And, the Jurassic period is way over the time of the dinosaurs. We're now living in Holocene, the past 10,000 years is basically the Holocene period, the epoch where humanity has, survived as a civilization. But there is a new suggestion, which is to call the current epoch, the 21st century epoch, as Anthropocene, again, because of what I said to you a while ago, the anthropogenic nature of the changes that we're seeing. It's humanity now that is the biggest force that is changing the face of the planet, in contrast to the previous epochs where it's, natural forces, whether it's ice age or that led to extinction of creatures. So this is a new epoch where we're living in, the Anthropocene, and it's a proposed name for the epoch. It has not been decided yet. But really what we're seeing now is a testament to the need for a reframing of the current time that we live in. And as I've said to you, all these activities are resulting in enormous damages to human health, whether it's climate change or undernutrition due to crop failures or water use. As we pollute our water sources, then fish stocks get depleted and water becomes poisonous when we consume them for drinking. And also even our soils are now being pumped with a lot of artificial compounds that disrupt the natural cycle of elements in nature. And these are the health costs of planetary health damage. 250,000 deaths annually due to climate change. That is a huge underestimate. Around 150 million people will be at risk for climate-sensitive malaria in the years to come. $30 billion health costs annually due to climate change. So, we're now very afraid of COVID-19 and its health effects, its consequences on the economics, and that's important. That's a valid concern, and we need to address them and to tackle them. But as you can see, long-term climate change is also going to afflict us, not just with deaths, but a lot of economic consequences that will kill people's lives, lead to unemployment, and even disrupt societies in the long run. So that is the case, why we need planetary health in this century. And then now I'm going to give you a brief introduction about the new discipline of planetary health. Okay? So this report in 2015, published by the Lancet and supported by the Rockefeller Foundation, launched this concept of planetary health. And it is being described as a new discipline, for the time or the epoch of the Anthropocene. And planetary health, which I already insinuated a while ago, this is how they defined it in the report. It refers to the health of human civilization and the natural systems on which it depends. And the other definition that was proposed more recently by the Planetary Health Alliance, which is headquartered in Harvard University, it is the international and interdisciplinary field focused on characterizing and addressing the human health impacts of global environmental change. So here you can see that really a lot, it's all factors that shape human health, whether they're living factors, your organisms, your animals and plants, but also abiotic factors like the soil or water or air, or even social factors like the economy, your urban environments, the industry. And I actually remember one of my mentors in environmental activism here in the Philippines, Tita Odette Alcantara. She passed away more than a decade ago. And she would always remind us about lahat. Lupa, araw, hangin at hayop, ako, tubig, lahat magkaugnay. And I think planetary health is the science of lahat. I think that is how we in the Philippines can frame and can brand and can communicate planetary health in a much easier and understandable way. And in here, you will see that planetary health is a convergence of the health sciences and the natural and the physical sciences. And this is interesting because usually it's a very small portion of the health sector that work with the environment sector. Usually those are the people who work on the area of environmental toxins or air pollution. But now you can see that even oncologists, cancer experts, or respiratory medicine folks, or even psychiatrists, because now there is an increasing link between mental health and environmental factors. All of them need to work with the agriculturists and the ecologists and the oceanographists in order to come up with joint up solutions for the health of people and the planet. And there's actually one, icon and pioneer in climate and health, in planetary health from Australia, Professor Anthony McMichael. He already passed away several years ago. And in the early 1990s, he was already urging the health sector to lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda, and I think that is planetary health. New forms of professional training in environmental health, but also in every profession and in every discipline. A preparedness to base policy advice upon predictions and best guesses. In addition, not just as opposed to, in addition to empirical data, because as we can see now, there's a lot of uncertainty in environmental and health issues, and an ability to collaborate with unfamiliar disciplines like climatology and ecology, a lot of the fields that I enumerated a while ago. So now, planetary health, some of you might be thinking, oh, it sounds like old bottle in or old wine in a new bottle. It sounds a bit familiar because we have fields like environmental health or sustainability science. Sustainable development is another very important concept. And there's also a debate, whether is planetary health really a new field or a new discipline? Is it a new or a novel policy framework? Is it a different kind of moral imperative or a unique scientific paradigm? Or is it just a sexier communication strategy to communicate the health, the health and environment issues to the millennials? I think it's all, but I think what is important is that planetary health is a mindset and a philosophy. It's an integrated approach and a unified vision that brings together the health of people and the health of the planet. That's how I usually simplify it for the young people. Here you will see how planetary health as a discipline has evolved over the past century. And this is a more simplified and linear way of representing this evolution of ideas. On your left hand, you will see how it emanated from the field of tropical medicine, which is basically about the health of colonizers living in colonies, the health of the Spaniards living in the Philippines in 19th century Philippines, of course, which then evolved into public health. And public health really is about health of people, usually in a particular locale. And then it evolved into international health, which is basically the health of our former colonies, and we need to make sure they catch up with the highly industrialized countries. And so we've seen a lot of international health projects in Africa, in poorer countries. And then global health was born, which is a dismantling of that rich-poor divide. It means everyone and every country is equally affected by health challenges because viruses, diseases do not respect national borders anymore. And that's why the responses to these health issues should be global as well. On your right hand, you will see the evolution from environmental health. And I would say environmental health is really the precursor, and it's still a field that is existing today. But what happened to environmental health is that it became more reductionist in approach, narrow focus, linear thinking, trying to look for the specific toxin and linking it to a specific symptom, or for example, the effect of lead on autism, or the effect of particulate matter on asthma attacks, for example. So that is what happened to the field of environmental health. And then the veterinarians came in and they said, we want to work with the doctors of humans too. And that's why One Health was born, the intersection between animal, human, and environmental health. And so we can think of zoonotic infections, diseases that move from animals to humans, as a prime example of a One Health issue. And then the environmentalists, the conservationists also step in, and they invented the term eco-health. How can we bring together forest conservation and health protection? And then geohealth also came in. It came from the geologists and the GIS people who are believing that there's a lot that can be obtained or drawn from Earth observations, GIS, data, for example, to understand health challenges and even predict where the next health problem will emanate from. So these are the two threads, and I think there is a convergence that is happening, which is planetary health, where all of these are just being combined and coming to and joining their forces in order to address again health of people, health of planet. And then here, this is a more elaborate way of representing this confluence of the different fields. As you can see, the threads that I mentioned a while ago are there, conservation medicine as well, systems theory, and there's also a lot of ethics involved because we talk about, what is our relationship with the planet. And, for the past, basically the whole time we are living on planet Earth, we've really seen the planet as our property that we can abuse and use, and not, really in the context of us being just a part of it. Okay. And then here you can see this is another way of I simplify it. It's about, planetary health encompasses all the different fields that I mentioned to you a while ago. And another way I see it is that all these different fields are just looking at the same elephant, but from different sides and different, at different parts. And so a One Health person may see the zoonosis, the leaping of a virus from the animal to the human, but a planetary health expert may look at land use change or forest destruction and how it provided the breeding ground for zoonotic infection. So, this is my way also of saying we're really trying to address all the same problems, and it's important that we all collaborate instead of, fight against each other in a very academic, intellectual fashion, just because we want to, protect our turf, our jurisdiction. That should not be the planetary health approach. And I already said a while ago that, this might sound very familiar, and indeed, this concept it's not invented by Harvard or any other expert that who lives right now. You go back to history, you return to the indigenous communities, and for millennia, for centuries, they have already understood why the health of people and the health of planet are deeply intertwined. And Chief Seattle once said that the earth does not belong to man, man belongs to earth. Man did not weave the web of life, he is merely a strand in it. Whatever he does to the web, he does to himself. So now, in the report, the 2015 report of the Lancet, it talked about, three main challenges of planetary health. Challenges that all these diseases do share, and all these problems do share. And what are those? The first one is what we call the conceptual and the empathy failures, or they're also called imagination challenges. And indeed, it's just so difficult and so complex to appreciate and to understand and to comprehend how an occurrence in the stratosphere 38,000 miles up above in the sky leads to some health effects in a coastal community, for example, in rural Philippines. It's just so hard to really connect the dots, and it really is an invitation to imagination and out of the box thinking. The second one is knowledge failures, what we also call research and information challenges. And linked to the first one, there are a lot of unknowns. There are things that we know, there are things that we know we don't know, the known unknowns, but there are things that we probably will never know. And those things actually contribute to the generation of disease. And so we need to be more creative, for example, in our research methodologies, in the types of questions that we ask, and the way we really conduct research in a cross-disciplinary manner. And then finally, there's the third set of challenges are called implementation failures, or what is also called governance challenges. And unfortunately, the design of our economies, the configuration of our governments, they're not anymore compatible with the magnitude, the urgency, the scale of planetary health challenges that we face today. And so we really need to think about new forms of governance and implementation. In planetary health, in sustainable development, we talk about ecosystem services. What are the services that we get from Mother Nature, from Mother Earth? And here you will see, provisioning services, your food, your energy, they all come from nature. Regulating services like the climate, it's a regulatory system that now we are trying to breach and destroy. And we know that, even in biology, if your body has an erratic regulatory system, then that contributes and leads to disease. Cultural services, because nature is a source of culture, things that make us really human, like the arts and the humanities. Our spirits are shaped by the environments surrounding us. And also supporting services, and these are things that are really invisible: biological diversity, or the cycle of nutrients in nature. And these all ensure that the first three services are functioning properly. So this framework came from the Millennium Ecosystem Assessment that was done from 2001 to 2005. But what happens when we destroy the ecosystem, we destroy the planet? Those ecosystem services lead to negative health impacts. and there can be direct health effects, because of direct exposure to these changes, whether it's heat waves or exposure to ultraviolet radiation or exposure to pollutants. There are also health effects that are ecosystem mediated. You alter the ecosystem, then you also alter the behavior of mosquitoes and other vectors that transmit diseases. Or you result in the depletion of food sources or even natural medicines. We know a lot of the medicines, antibiotics that we use today emanate from nature. And finally, there are indirect effects. And indirect effects include population displacement because of flooding, for instance, or even conflict because communities are fighting over scarce resources. And the grand challenge really of planetary health is how can we create a safe operating space for humanity? And right now, I'm not sure with you, but I don't feel safe with all the issues that we encounter at the nexus of health and environment. And why is that so? The Stockholm Resilience Center developed this concept and framework called the Planetary Boundaries Framework. And here you will see that so far they've identified 9 planetary boundaries. And the thesis is that if these boundaries are violated, if these limits, the planetary limits or thresholds are breached, then the planet will be less conducive or even unconducive for human survival, for the sustainability and the living of our civilization. And unfortunately, as you can see, 2 of the planetary boundaries are already in red. And those are biosphere integrity and freshwater, and biogeochemical flows. And that is alarming. 2 out of 9 have already been violated because first, we've seen the fastest rate of extinction of creatures great and small over the past century. And second, nitrogen, that's N, and phosphorus, that's P, 2 elements, their natural flows have been tremendously disrupted because, again, of our addiction to fertilizers, artificial fertilizers for food production. And then now you see that there are 2 planetary boundaries that are at risk of being breached. And what are those? Climate change. We know that the Paris Agreement set a threshold. We cannot go beyond 2 degrees Celsius increase in global average temperature. Otherwise, we are doomed to long-term, civilizational decay. But also land system change. We have turned every natural ecosystem into subdivisions and golf courses or even cities. And then now we are destroying land, which is an abiotic component of the planet that we always take for granted. And then, of course, it's not enough that we do not violate the ecological ceiling, the planetary boundaries. We need to make sure that we also achieve people's human needs. We reach a good level of the social foundation that underpins humanity. And as you can see there, we need to make sure people have access to water and food and health and education and income and gender equality and political voice. And it means that we need to be in that middle part. And that is why that planetary boundaries framework was turned into a donut economy framework by this woman economist from Oxford, Kate Raworth. And she was urging us that the new economy should be within that safe and just space for humanity inside a donut, not overshooting the ecological ceiling, but also not having shortfalls in the social foundation. And so, this book, I think, should be a required reading for every professional, not just health professionals, not just the economists, not just the environmentalists. And this is an interesting study. In 2018, there was a study that was conducted by the University of Leeds, and they tried to assess which of the countries in the world is closest to becoming a donut. And, usually I give this as a quiz to my students, but here you can see the US, they've achieved almost every social foundation that exists, and that is represented by the blue part of the donut. But as you can also see, they've also violated almost every planetary boundary that exists. And that is not a donut, definitely. That is not sustainability. That's not an example of sustainability. Meanwhile, as you can see in the middle, Philippines, our country, um, we have not breached any of the planetary boundaries, and that's good news. And we need to make sure we retain that and we sustain that. But on the other hand, you will see in the middle portion that we have not achieved almost all social foundations: food, access to water, access to education, access to healthcare, universal healthcare is still on paper. And so we are still not very close to becoming like a donut. But guess which country is at the top of the list? That is our neighboring Vietnam. As you can see there, they've almost achieved all social thresholds or social foundations, and they've only violated and violated slightly one planetary boundary, and that's the boundary of climate change. And we also know that Vietnam, until today, has zero COVID casualties. So we might want to ask, what is happening in Vietnam in terms of protecting the health of both people and planet? That should be our next field trip after this lockdown is over. And really, this is an invitation to rethinking the way we look at the economy and our ecology. If you notice, both words begin with eco, which means home in Greek. And planetary health, I think, is also about the management of our home. And right now, our framework, our mindset is that of an empty world. The economy is, a small part, and the ecosystem is not taken into account. But what needs to happen is a reframing, and a full world means that economy and the ecosystem overlap greatly. And that means the economy should respect the ecosystem and not look at it as a property to abuse and to be a dumping site of what is wasted. And that also is linked to the concept of circular metabolism or the circular economy. We want economies that are not wasteful, that recycle all the materials that are being used. And we can think of cities, for example. Much of the food that cities consume come from outside of it. And then a lot of the food is not being, eaten actually or wasted. And where do these wastes go? And so we really need a rethink of our economies, our cities, to make sure they're circular, to make sure they're recycling, to make sure that it's not a cradle to grave approach, but a cradle to cradle philosophy that we espouse. So this is another simpler way of showing how, what's the difference between our current linear economy to what we should envision, which is a circular economy, which is again linked to the concept of a donut economy. And then planetary health challenges are also issues of equity and justice. Because as you can see here, environmental change will exacerbate the gaps between the rich and the poor. Those who are already poor, those who already have no resources, good housing, clean access to water, living in slum areas, inhaling toxic fumes coming from a nearby factory, they are the ones who will get the disease. They are the ones who will not have access to healthcare. And so it just creates a vicious cycle of poverty and inequality and injustice. And so a planetary health approach cannot turn a blind eye to these inequities, to the issues facing the vulnerable and the marginalized. And this is an example. You can see that climate change is an issue of health inequity. At the top, you will see the parts of the world that have been magnified or enlarged. And these are the parts of the world that have emitted the greatest amount of greenhouse gases over the past century. That's Europe, that's North America, and China as a newcomer. But there at the bottom, you will see the parts of the world that will bear the brunt of climate change, that will endure the health suffering that climate change will bring. And those are the countries that have nothing to do actually with climate change. They have not emitted a great deal of carbon to the atmosphere. They have not even been developed, and that's why they're called developing countries. And what are those? Africa, parts of Asia, and I would say even the Pacific, but unfortunately the Pacific are too small to be enlarged, or maybe by 2030 they are already they've already disappeared because of sea level rise due to climate change. So now I'm moving to part 3, and I know this is a long lecture, a very comprehensive one, but I hope you're learning a lot from this survey of the whole planetary health field. And I'm going to present to you some of the planetary health challenges to give some ideas to especially our young researchers here in the audience who are thinking of what planetary health projects to pursue. So I already talked about climate change, and look at me there in front of the UP College of Medicine holding a placard saying that climate change is the biggest global health threat of the 21st century. That was said in the journal The Lancet in 2009. And then in 2015, The Lancet expanded it by saying that tackling climate change could be the greatest global health opportunity of the 21st century. If we address climate change, we will not only prevent the diseases that are associated with it, but it will also generate a lot of health benefits for people, for communities. Unfortunately, we live, in a climate and health hotspot. And that is Southeast Asia, as you can see here in this map. The redder the country, the more vulnerable to climate the country is. And unfortunately, our country, the Philippines, is the reddest of them all. And it just shows to you, indicates to you how vulnerable our country to climate change and its health effects is. And I already said a while ago that climate change, or the Philippines rather, is I want it to be the Silicon Valley or the Silicon Islands of planetary health. But I think it's also at the heart really of planetary health. And as you can see, they're both start with PH. And this is a photo from Typhoon Haiyan, which hit with the Visayas in 2013, the strongest typhoon to ever hit land in human history, killing thousands and displacing hundreds of thousands and affecting millions. And here you can see Typhoon Haiyan, already as large as the country itself. And then here you will see what happens when a climate-induced extreme weather event does occur. Not just your buildings, not just your livelihood, your food systems, your water systems, your education system, but also health systems are affected, disrupted, if not destroyed. Even health workers become victims of calamity, as as you can see, even for COVID-19. Unfortunately, our health workers, our frontliners, are not immune to the virus. And indeed, in the front page of the Inquirer, it says there that it's the worst disaster to hit PH. And PH, as we know, is the Philippines, but also it pertains to public health and also planetary health. And then here, when we talk about climate change and health, we always think first of natural disasters, the diseases that they bring, the injuries and deaths that they generate. But climate change also has a wide range of health effects. And this diagram shows to you the many different pathways through which climate change affects health. It's not just through typhoons or storms. There are also droughts, there's flooding, exposure to intense heat, and on your right hand, you will see that no disease group is immune to climate change. Every health condition is expected to be affected, whether it's undernutrition or heart diseases due to heat stroke, or respiratory diseases due to air pollution, or even mental health due to sudden abrupt natural disasters, but also the chronic stress that is brought by heat and climate instability. And then here, this is from my dissertation. I'll not belabor you with the details, but you will see that this is in the Philippines, especially in a coastal community in the Philippines. There are many different pathways that lead from climate change to health impacts. And at the bottom, I want you to pay attention. There are current or known impacts that climate change will exacerbate, like undernutrition, mosquito-borne diseases like dengue, waterborne diseases like typhoid, but also there are anticipated or projected health impacts that we are yet to see. And what is concerning to me, for example, is the hypertension coming from high salt intake due to the salinization of water, or mental stress as well, but also the resurgence of neglected tropical diseases, again, because of the changing climate. And then here, I already mentioned dengue, infectious diseases. The mosquitoes are now found in places where they're not expected to be present. There's even some cases already in Europe. And then here, I already mentioned to you about sea level rise, which intrudes into fresh water, which leads to intake of highly salinized water. And then that leads to hypertension, preeclampsia, or hypertension among pregnant mothers, and even kidney stones. There's already evidence of that in Bangladesh. And I wonder if that is already the case in coastal communities in the Philippines, especially that we are facing the fastest rate of sea level rise in the world, 5 times that of the global average. And of course, our neighbors in the Pacific, these islands are already slowly disappearing. Some islands are already looking for places to move to. They're discussing with Australia, for example, trying to purchase pieces of land so they can move to those places once sea level rise has completely inundated their islands. And that will lead to global migration, and that is scary. Climate-induced migration, which will render people more vulnerable to health impacts, to instability and insecurity, limited access to food, etc. So I'm not going to detail, but this shows to you how they're all connected. And so, some newspapers already describe this as the era of climate change refugees. And I don't like the term refugees, because refugee is a term used for people who are fleeing away from countries that are in conflict, fleeing away from persecution, political persecution. But in this context, people are moving away from environmental phenomena that we induced on ourselves. Again, anthropogenic climate change. Okay. And so apart from the health effects of climate change, it's important to also tackle the sources of climate change, and that is energy. And here I'm just sharing with you some pictures of mine. Before going to Harvard, I was the coordinator of the Healthy Energy Initiative for Healthcare Without Harm, Asia, where we really advocated for the incorporation of health into discussions around climate change and energy policy. And so there you will see we're saying coal kills, and that's why we need to kill coal. And then at the bottom, you will see me visiting the Bataan nuclear power plant. Nuclear is also going to present hazards to human health as well. And then at the top, you will see me in a press conference with the late Secretary Gina Lopez, Secretary of the Environment. And there are a lot of studies already showing the links between energy and health. And here you will just see that the most carbon emitting energy sources are also the ones that lead to diseases and deaths due to air pollution in particular. And so at the bottom, you will see, or at the top, you will see, coal, lignite, which is the softest form of coal, and oil. These are the most health and climate disruptive of energy forms. But at the bottom, you will see biomass, for example, or natural gas, and nuclear. Of course, while it says here that they are perhaps healthier than the earlier options that I mentioned, we should take these evidence with a grain of salt. That means we need to ensure there are necessary safeguards to protect us from the health risk, let's say, of nuclear or natural gas. And I invite you to Google this. 5 years ago, I produced a short film about climate change and energy and health in the Philippines. It's entitled The Big Show. And really, the big show of clean and healthy and climate-friendly energy is in the Philippines. And what is the big show? B for biomass, G for geothermal, S for solar, H for hydroelectric, O for ocean thermal, and W for wind. All these renewable natural energy forms can be found in the Philippines. Why are we not harnessing these to power our future? And I've been involved in several studies at Harvard trying to quantify the health and climate benefits of renewable energy and, for instance, at the bottom, carbon taxation, or ways to cost and to pay for carbon emissions. And basically, the results show that we can reap a lot of health benefits, but also a lot of economic savings from the adoption of clean, healthy, renewable energy. But because the climate action is still very slow, this is what's going to happen. We are now on the trajectory of reaching what is called a hothouse Earth. And a hothouse means, so before the term was greenhouse, global warming, right? Or greenhouse effect, right? And in a greenhouse, the temperature is controlled. You try to simulate the good conditions so that your plants do grow adequately. But here in a hothouse, it's uncontrollable heating of the planet, which then leads to these series of effects or feedback loops, destruction of the Amazon, melting of the ice caps, summer monsoon in this Indian subcontinent, destruction of coral reefs through coral bleaching. So all of these are just happening at the same time and accumulating and contributing to one another. And that will lead us again to a hothouse Earth, which will be less conducive for human living. So the question really that we need to ask is, are we ready to build the health systems that consider the climate? And, that is the topic of my doctoral thesis. And, I wrote 200 pages of a report, but early on, I already knew that those 300 pages will be read by probably only 3 people, and that's my committee. So I turned my dissertation into short films. And, you can look at my YouTube channel and you will see the case studies of Del Carmen in Surigao del Norte and Ahuey in Iloilo, where I investigated this concept of climate smart health systems. How can health systems incorporate or be oriented towards climate protection? And here you will see that the health system can actually do so many things to protect the health of their people from long-term climate change. Whether they act on the determinants of health or the health system, the hospitals and the clinics, or the health outcomes, making sure that the baseline health status of the community is high enough to endure long-term climate change. And then here, this is a much newer framework that I developed, that in the era of planetary health, health systems should be characterized by these four, main qualities. And one is universal, leaving no one behind. And, we already have a universal healthcare law that we really need to implement. Okay. It should be high value, and when I say high value, people should be confident about the competent healthcare that they receive, resulting in good health outcomes. It's safe. It doesn't contribute to additional disease, whether intentionally or unintentionally. It's affordable. And really, your customers, your patients leave the healthcare system happy and satisfied. The third one is climate smart. And climate smart is a term that is the convergence of both adaptation and mitigation. And when we say adaptation, we need our health systems to be responsive and resilient to the effects of climate change. But mitigation means that health systems should also be low carbon, that they are not accomplice to the crime of global climate change. And then the fourth one is that they're pandemic resistant. And this definitely is in the latest edition because of COVID-19. Health systems need to detect early, respond quickly, resources are always ready, and we can better recover once the virus has already been contained and suppressed. Maybe you're asking, is COVID-19 or the coronavirus linked to climate change? Is there a connection? Let's investigate. And I actually wrote an article about that in Rappler on Earth Day, which, by the way, this year we celebrate the 50th anniversary of Earth Day. But it's a really bizarre Earth Day because there are no street protests or street marches, no press conferences, no tree planting activities. And so I invite you to look into this. But here's the summary. The first one is that really climate change, the heating of the planet, makes the environment really conducive for the emergence of infectious diseases, both the old ones and the new ones. But also environmental changes or our abuse of the environment, like wildlife consumption also tightens the link or the interface between animals and humans, and that leads to what you call a zoonotic leap. Again, a while ago I mentioned that diseases get transferred from animals to humans, and that is what happened in Wuhan in China, in a fish market where apparently this disease that came from the bats, which is the host reservoir, then infecting an intermediate host animal, could be a pangolin, could be a snake, then came into contact with a human being in the market, and that led to now more than 6 million cases worldwide. And that just shows to you how, again, a microscopic, invisible virus can affect the whole world in just a matter of days, weeks, or months, again, because of that animal-human spillover. And COVID-19 is not the only zoonotic infection. In fact, 70% of the infections around the world, the emerging infections, are all coming from animals. And it's just a matter of time when the next epidemic happens, and maybe it may erupt somewhere in Southeast Asia, maybe the Philippines, we don't know. We need to be ready. And unfortunately, as we know, as we have observed, our healthcare systems, now under shock, are not ready for the pandemic and not even ready for climate change, long-term climate change. So this is really a sneak preview. It tells us that, it reminds us that our health systems are not ready for the longer-term climate change that we are anticipating. And in the early phase of the epidemic response, maybe we're not thinking about the environment, but now we're in month 3, and it's now time to check whether our response is creating new forms of pollution. Like, as you can see here, PPEs, face masks, being improperly disposed, for instance, into the environment. Of course, you have seen also reports that because of the economic shutdown and the societal lockdown, there might be some environmental benefits that have surfaced. We've given a respite to Mother Earth. Here you can see China has cleaner air, a much cleaner and clearer air mass on top of it. And indeed, some newest studies show that there has been a huge dip in carbon emissions over the past 3 months, even reaching 2010 levels, as you can see there. And that sounds like a good news, right? That the decarbonization is indeed possible. And the reduction of carbon has greatly emanated from surface transport, because there are no cars anymore roaming around, or the industry and power, because coal plants and factories have been shut down. Okay. And then, of course, we are not, early in the pandemic, there are a lot of pictures being shown in social media. You can now see the mountains of Rizal from Metro Manila. But I just want to give a word of caution that we cannot and we shouldn't romanticize these environmental benefits, because this is not the kind of decarbonization that we want. Decarbonization through a pandemic by circulating a virus around the world is not a good option, because it kills lives and it marginalizes people. What we need is decarbonization that is gradual, planned, and intentional, that will that does not kill people's lives, but also takes into account the negative consequences, especially to those who have nots. And then, of course, right now the attention is on COVID-19, but the bad news is climate change has not stopped. A 3-month respite for Mother Earth will not stop all these effects, because climate action needs to be sustained and long term. And so in the next couple of months, we can just expect more typhoons in the Philippines. The wildfires in Australia will happen again in January, when COVID-19, the vaccine for COVID-19 probably is still not available. Heat waves in Europe, etc. So really, we need to make sure that climate action still continues while COVID-19 is being addressed. And then, now I'm shifting gears. I'm moving to food, which is another planetary health challenge. And so far, studies have shown that we have enough food, at least for, we were able to sustain during the past few months, but in the coming months, we don't know. And this is the challenge when it comes to the food system. There is what you call a global syndemic of obesity, undernutrition, and climate change. And when you say a syndemic, it means several epidemics happening at the same time. And that is not good news. Right now, there are more than 1 billion people who are obese, over-consuming. Another billion of people under-consuming, they're undernourished, they're stunted, they're wasted. And then that same food system that creates both obesity and undernutrition also emits carbon and results in climate change. That is a recipe for destruction. And as you can see here in this graph, there's a global overconsumption of high carbon and less nutritious food products, such as red meat. And here you will also see in this graph that red meat, unfortunately, is the most resource-intensive food product. They emit greenhouse gases. They use a lot of land. They use a lot of energy coming from fossil fuels in particular. They lead to eutrophication of lakes and acidification of oceans. So, these are all the effects of meat eating and meat production to the environment. We know, so I already mentioned that they're a major emitter. About 15% of total greenhouse gas emissions come from the meat industry. And of course, even WHO already declared red meat and processed meat as carcinogens. They increase the risk of cancer. So now meat is not only emitting carbon, they're also giving us cancer. And we know also that the food system, I already mentioned a while ago about obesity. This is an example of an obesity map, showing to you all the factors that lead to obesity. So it's not just about telling people not to eat. When we know that, or to eat healthily, when we know that the food system, the markets that we go to, the factories and all, they're all contributing to this complex web that leads to global obesity. Another problem that is linked to food is antimicrobial resistance. And right now we're afraid of COVID-19, but I think we should also be equally afraid of antimicrobial resistance. And these are some of the projections of antimicrobial resistance that we expect to occur in the next 20 years or 30 years rather. Antimicrobial resistance is when your antibiotics are not anymore effective. They're not anymore working because your bugs, your bacteria are already, have mutated. They're already resistant to these medicines. And there will come a time when your surgeon will prefer not to operate on you because you will die faster of infection and not of the cancer or the tumor. So, as you can see here, around 10 million people expected to die by 2050 due to antimicrobial resistance. Okay? And guess what? It's not, just human medicine that is contributing to antimicrobial resistance. Around 25% of the irrational use of antibiotics come from us, doctors, physicians, the healthcare sector, patients who buy medicines over the counter without prescription. But the bulk, 75% of the misuse of antibiotics comes from the meat sector, poultry, livestock rather, because we are pumping chickens and pigs and cattle with antibiotics as if they are vitamins. And now we consume these animals which contain antibiotics and as well as bacteria that are already resistant to the antibiotics. And so there is a suggestion, a recommendation in 2019. There's a major study that proposed the adoption of what you call a planetary health diet. It's a form of diet that provides good nutrition to people, but also does not destroy the planet. And as you can see, that plate should comprise, half of it should be vegetables, greens, fruits. And as you can see, red meat is a very small portion of the plate. And I think the estimates is that if you turn it into a weekly meal plan, it should only be a single serving, one serving for an entire week. And I wonder if meat-loving Filipinos are ready for that. And so, to protect the planet and to also improve our health, there is a major shift in diet that needs to happen from a predominantly meat-based to a predominantly plant-based diet. And addressing meat consumption is what I would, call a nexus solution for planetary health. And a nexus solution brings together, or addresses several problems at the same time, nexus, intersection. Because reducing meat is a quadruple win for both people and planet. We reduce non-communicable diseases like cancer. We reduce carbon emissions to prevent climate change. We lower the risk for antimicrobial resistance. And we even prevent zoonosis because we know that zoonotic infections like COVID-19 emanate from animals, our interaction with them. And, I talked a while ago about, the governance challenges. We really need to start imagining the future governance for the health of people and planet. How can we make the Department of Health think about planetary health? How can we make the whole government of the Philippines adopt a planetary health framework. And even at the level of global health governance, planetary health governance, you know, we only think of WHO, the World Health Organization, as a health actor. But do you know that there's also a WHO for animals, which is the OIE, the World Organization for Animal Health? How about the likes of the World Bank or, the institutions that govern the environment? They are all part of the new planetary health governance that should emerge in the near future, or even now, as early as now. Now I'm going to the fourth part, which is the future of planetary health, research, education, and practice. And, you know, I want to just mention some of the principles of planetary health research. So if you're going to design your own research in planetary health, these are some of the main pointers. One, you should adopt a planetary health lens. It's human health vis-a-vis the social ecological systems that we already covered. And that means also a multi-species consciousness. It's not just about the health of humanity, but also the health of creatures great and small, your animals, your plants, the microorganisms. You should adopt a complex adaptive systems framework because planetary health is multifactorial, non-linear in direction or multidirectional. There are feedback loops. I've mentioned that already a while ago. And there's also a lot of emergence and surprises, uncertainties that we know. There should be also a very strong concern for equity and justice. We don't do planetary health, not just to improve the health of people and planet on an aggregate scale, but also we want to make sure that, gross inequities are reduced because they are unacceptable. We have a special concern for the poor, the vulnerable, and the marginalized. There should be cross-disciplinarity and cross-sector and a cross-sectoral approach because no single discipline or sector has the solution. We should have a concern for long-term sustainability, intergenerational in approach, because we want to live a livable world for those yet to be born. And finally, it's evidence for action. We're not doing science for science's sake for you to have a publication. We are committed to problem solving, to solving real problems. And then, what are the purposes of planetary health research? And these are some of my answers based on my survey of the different papers that have emanated, but also the papers that are yet to be written. The first is we need to establish relationships, whether they're causation. Does X cause Y? Or correlation, is X or Y are they associated? Planetary health research seeks to unpack complexity. How do we unpack that complex obesity system or the food system that I just showed to you a while ago? Assessing current state and trajectory. What is our current situation of planetary health in the Philippines, and where are we headed to? Are we headed to a worse state, or a state of poor health and unclean and unsustainable environment? But it's also an opportunity to envision alternative futures. They always say that the best way to predict the future is to create it. So how can we design the new cities, the new food systems, and how do we craft the new economic policies for planetary health? And finally, designing and evaluating solutions, whether they're a specific intervention or a complex combination of multiple interventions. What are the elements of a planetary health research? You will see that there's a spatial dimension. Your research can be global or regional, for instance, Southeast Asia, or focusing on a particular ecosystem, the watershed, for example, or the tropical rainforest. At a national scale, you can do research like, the Philippines, the country, subnational, like our regions, but also at the community or local level. But there's also a temporal dimension. So it's always, planetary health problems operate in both in space and time. And when it comes to the temporal dimension, we can do retroactive work, looking at historical trends. We can do present assessment, like in a cross-sectional study. What's the current situation of planetary health? But also we can, again, do futuristic studies, doing mathematical modeling or scenario building. And then, of course, we need to identify the health outcome that we're concerned, and that is a wide range from health to death and everything in between. It can be a disease, it can be a form of a disability, but it can also be a subclinical phenomenon. For example, COVID-19, as we know, can be you can be asymptomatic, and so we need to have some measures. Let's say, composition of a chemical in your blood to study, for instance. And then health determinants. We can go from the proximal, the accessible, the reachable, the downstream. Whether they're individual factors or household factors, up to the distal, the upstream factors, economic factors, political drivers, ecological elements. And then finally, health responses. Whether they're responses to the healthcare system, what should hospitals do? What should doctors do? Or the public health, the broader public health system, community health, health policies. And then ultimately, the broader societal response, the economic changes that need to happen, the political changes that need to occur. And you can already predict that based on what I described to you a while ago, really planetary health needs a cross-disciplinary approach. And you can see here, the health sciences have a role. Those who work in the labs, like the virologists, the clinical scientists, like your kidney experts, or population health sciences, like the field of epidemiology, they need to work with the natural sciences, the biologists, the physicists, the environmental sciences, with the social sciences, economics, anthropology and sociology, psychology and political science, and even the mathematical sciences, data science, mathematical modeling, and even artificial intelligence. All of these have to work together to create a great planetary health research project. And I already reiterated a while ago, we're doing evidence for action. We're not doing science for science sake. And so evidence to policy translation is so important. And this is how I see, how we can translate the evidence. For global evidence, that creates generalizable knowledge. We know that PM 2.5 leads to asthma attacks. That is now a global norm, an international norm, industry standards and guidelines, emergence of new international orders. So these are the ways global evidence that are usually the result of multi-country collaborations can benefit, international policy. At the level of the region, we can design regional planetary health research to help in the development of regional policies, for example, in ASEAN, or to develop or to create multi-country collaborative interventions. At the national level, like in the Philippines, we can use planetary health knowledge to craft national policies, not just in the health sector, but also in the environmental, but also economic, social, etc., and as well as in the design of domestic programs. And then finally, local evidence is so important for the generation of local interventions or context-based education of the members of the community. And so this is just another example. If you are going to create a planetary health research project, the way I see it is it's really at the nexus of the social and ecological sciences and the human health sciences. For example, if you're studying species conservation and I'm studying medicinal plants coming from wildlife, then we can work together to come up with a planetary health project. So these are just some examples, or green spaces in cities, and linking it to the field of mental health. I'll not go into detail, but these are just some examples. And then, of course, if we want to promote planetary health research, we need to educate the researchers of tomorrow. And these are just some of the principles of planetary health education. I'll not go into detail, but as you can see, a lot of these elements I already mentioned throughout the lecture. And then, of course, we need to make sure it's not just the world of research and the world of practice or the world of education that absorbs or adopts planetary health. We also need to make sure that the field of practice is also planetary health oriented. And here I created a 7I framework. How do we institutionalize planetary health into government or business? How do we integrate different planetary health issues and agenda items? Where do we find the investments for planetary health activities? How do we bring together separate information from climate change to water to social factors to health to make sure we come up with answers to planetary health problems? What is the role of innovation and entrepreneurship in coming up with planetary health solutions? How do we implement planetary health interventions better? And how do we create planetary health inspiration or instigation? How do we spread, quote unquote, the virus of planetary health, the positive virus of planetary health to the world? Okay, and that is what I've been doing for the past 3-4 years. Helping create and develop and enrich this young emerging field. And I was privileged to be in these kinds of rooms and discussions. And really, my mission and my obligation is to make sure that this gets spread to the world, especially to developing countries. And now we have a Planetary Health Alliance. As I've said, it's headquartered in Harvard University. And I invite all of you to be part of this alliance of exciting, emerging scholars from all disciplines working for the health of people and planet. We have our 4th meeting upcoming, and that will happen in Brazil in 2021. I hope by that time COVID is over, or at least have been stabilized, so we can all go to Sao Paulo. There's another network for planetary health. It's called In Vivo Planetary Health. And they actually came up with this, what you call the Canmore Declaration. Canmore is in Canada. And again, same principles that a lot of them already mentioned to you a while ago. It's very interesting. It says they're countering elitism of science, because always in science, we think we're in the ivory tower and we give the prescriptions to the world's problems. But now is the time to really, be humble and acknowledge that we really know little about the health of people and planet. Okay? And a lot of institutions around the world are already establishing planetary health programs, from Harvard to London to even the Italian Institute for Planetary Health. And now that I'm back in the Philippines, I hope, and I'm currently having discussions with friends and colleagues to build the planetary health as a field and the institutional arrangements needed here in the country and even in Southeast Asia. There's already a journal for planetary health, and more are yet to come, but there are also other journals that are open to planetary health papers. I'm currently, the youngest member of the editorial advisory board of the Lancet Planetary Health. And there's also a new upcoming textbook of planetary health that will be launched. And I hope to also edit a future book about planetary health, covering voices from the global south and developing countries. Okay. I also co-developed this 10-point guide on how to build a planetary health club. And right now, a lot of students from around the world are building planetary health clubs in their schools and universities. I hope our students listening today will also build their own planetary health club. The clinicians are also invited to participate and advocate for planetary health. So as you can see, even the doctors who treat patients are now slowly adopting this planetary health paradigm. Okay? And, I have a deep regard for the women who are leading planetary health. And these are all my friends. There's a new initiative called Women Leaders for Planetary Health. The past world, the past century has been led by men, which really destroyed the planet, unfortunately. And then now it's the women leading planetary health, women who will sustain the planet for future generations. And it's not surprising because we don't call Earth Father Earth. We call it Mother Earth. You know, you go back to ancient times and the Earth is always considered a mother, a woman. And actually, one environmentalist taught me it's the factory that should be called Father Factory. So, this is an invitation to more women to really partake in this planetary health journey. We invite businesses to also contribute to planetary health, to be entrepreneurial in addressing these problems. And here, this is just an example of a framework on how we can build planetary health-oriented businesses, from employee health to consumer health, to community health, to environmental health. There's a new Rockefeller Foundation and Oxford collaboration talking about how should the new economic system look like in order to promote planetary health. We hope to see the report I think, within this year. Okay. And then, so, and I will continue to be promoting planetary health internationally. As you can see, I've been very busy over the past several years. And now that I'm back in the Philippines, you can see me there in the UP College of Human Ecology. On Thursday, I actually have a webinar with them. And this is an exciting time for planetary health and for the Philippines. And especially now in COVID, but also in the post-COVID future. As I've said, we're building SIFA, the Southeast Asian Planetary Health Alliance. You're all invited to join. And also, we're also building PH Squared, Planetary Health Philippines. You might see some familiar faces. And again, really creating the movement for the country. And this is the way forward for our country, to collaborate between disciplines, to create our community, to identify key priorities, launch a science-based advocacy, and to educate and train future planetary health professionals. And in our work in planetary health, we need to make sure that we work with the communities in the front lines, but also the policymakers that will affect planetary health change in a systemic way. So my parting words, my last words for this presentation, how do we reimagine planetary health in the post-COVID world? And indeed, COVID-19, this pandemic, is a portal, a gateway between one world and the next. And we need a new compass. I believe that compass is planetary health. We still have the Sustainable Development Goals. We have 10 years remaining to achieve them. Now COVID-19 has disrupted our global progress towards it. Maybe it's time to revisit if the SDGs are really the language and the blueprint for a planetary health future. And as you can see, planetary health, Sustainable Development Goals like planetary health, they're all interconnected, multifactorial. And unfortunately, as I've said, COVID-19 has already affected all these SDGs that we have seen. This is perhaps the most popular graph in this day and age, the flattening of the curve of COVID-19 so that we don't exceed the healthcare system's capacity. But there is also another curve that we need to flatten, and that is the curve of our carbon emissions, our ecological footprint. And unfortunately, while the healthcare system's capacity can be increased by adding hospital beds or recruiting more health workers, the Earth's capacity cannot be changed. It's non-negotiable. And the planetary boundaries cannot be altered. And so it's us that needs to adjust, and we need to adjust our curve. Because if not, there will be much bigger waves. We're talking about the second wave, the third wave. There's a lot of debate about that in the Philippines. But I think the much bigger and much scarier wave of climate change and long-term planetary health change is the one that should bother and concern us, and we need to act now. And that's why we need a healthy recovery from COVID-19, a global Green New Deal that will transform our economy for the future. And, we love to use the term new normal, but there's really nothing normal in the old pre-pandemic state. So I discourage you from using the term. What we need is, a normal that is planetary health oriented. We need to renovate the political economy of planetary health from one that promotes limitless growth, this imaginary limitless growth that abuses the planet and creates disease, to one that is in the form of a donut that protects the planetary boundaries and meets society's vital needs. So this is an article that I wrote recently. I invite you to read it, in Reimagining the Political Economy of Planetary Health. And there I mentioned 5Ds for our planetary health future: degrowth, decarbonization, deglobalization, decolonization, and democratization. And we know democracy is now under threat, especially in our country, but also in the United States. So we need to work on these 5Ds if we want COVID-19, the post-COVID-19 future, to be in harmony with people, between people and planet. We don't want to be this kind of doctor giving the cough syrup and ignoring the root causes of illness and health. Instead, we need to be this kind of doctor who is a solar panel hugger, promoting planetary health and embracing a much greener, much healthier, and more sustainable future for our generation and for those that are yet to come. So, and then finally, I just want to show to you this is the last slide that I presented when I defended my dissertation at Harvard. And I took that as an opportunity to present my personal manifesto, about my planetary health purpose. And this is an invitation to all the young people here to be devoted to systems thinking, cross-sectoral work, and innovation, to have a deep concern for the health of both people and the planet, with equity and justice at the core, and to commit to translating knowledge into action and delivering concrete results. All of these in the service of the world's poor, the vulnerable, and the marginalized. So together, let's advance the health of both people and planet. Thank you for your patience for that long lecture, and I look forward to your questions and some interaction. Again, thank you, and stay safe.
Thank you very much, Dr. Ginto, for that very timely discussion, especially now that we are experiencing this pandemic, or should I say a planetary health emergency. Because I think this COVID-19 pandemic has actually animated the concept of planetary health, if I'm not mistaken. Indeed, we need to understand the fine balance between human health and the ecological disruptions that sadly our society has caused. And these disruptions of the ecological balance have actually some implications to our health. Now, I am sure our audience have a lot of questions in their minds, and they're very much excited to ask our guest speaker. So just type in your questions in the chat box via the UPOU networks. But in the interest of time, we may not be able to address all your questions, but don't worry, just leave your questions in the chat box together with your email addresses, and then we will send in the questions via your email. So now I am now giving the floor to Miss Jessica for the question and answer.
Okay, so thank you, Mom Pepper, and I just want to greet everyone. Thank you for still tuning in. Thank you for viewing our webinar. And personally, I can say that it is really an interesting and informative lecture, and it's really amazing. And I've been seeing a lot of comments from our chat room and YouTube, even in our UPOU networks, that they are interested. A lot are being, like, memory information overload, but still it's very okay. So thank you so much, Dr. Ginto. I might probably watch this again to review the informations I learned. So thank you. Okay, so let's now proceed to our question and answer, because we might not address every question because it's very, we are receiving a lot, but we have time limitation. So without further ado, let's proceed to our first question. Okay, so it says here, is it right to say that our vulnerability to climate change in our poor planetary health category are mainly due to our geologic location, being an island country in Asia? and not due to anthropogenic in nature.
Right.
Dr. Ginto?
Yeah, thank you. And you know, the answer is you know, it's multifactorial. Vulnerability is the combination of, you know, exposure to your hazard, your adaptive capacity, you know, and geographical location is also part of it. So it just happened that, you know, we're in a tropical country facing the Western Pacific where the typhoons emanate from. Tropical country with forests where the, you know, where the viruses all circulate around, and then you have the society. So let's not forget about the society that unfortunately is still you know, marked by gross inequality, right? The haves and the have-nots. The divide is so wide. You have weak governance, right? You have healthcare systems where there might be a building, but there's no health worker and no medicine. So imagine all these different, you know, it's a combination really of problems and factors that we need to address. And that's why the planetary health approach is so important, because as you can see, it's very comprehensive and holistic, trying to address the different elements as opposed to a more, you know, a reductionist, linear thinking, narrow-minded approach where you only address the symptom, but, you know, forget about the root causes. So that's my quick answer to that question. Thanks.
Wow. Thank you so much, Dr. Ginto, for that. And let's proceed to our next question. It is based on the planetary health principle you discussed. And the question is, of course, with this planetary health principle, environmental education should be strengthened. So the concern of this viewer is due to the shift of teaching delivery and learning mode in the Philippines, how can we instill environmental education among students or planetary health as a whole?
Okay. First suggestion, show this recording to your students. Very practical. But of course, maybe a lot of the content might be too heavy, for example, for primary and secondary, even secondary school. So I think there's potential for you know, students to or for your teachers who are listening to simplify the messages, right? And
Yes.
to make it more accessible to their young students. So I think it's our teachers who should watch this recording again, right? And
Yeah.
then try to simplify them, turn them into very digestible messages. And if, as you also notice, I tried to make it digestible, right? Because it's also important, if you notice in that 7 eyes, inspiration is at the top. And that also is linked to effective planetary health education and communication. And unfortunately, a lot of our scientists today love their jargons to the point of not being understood by politicians and the public alike. So now, if we can, you know, I said a while ago, planetary health is the science of lahat. Lupa, araw, hangin at hayop, ako, at tubig, or even tao. So that is the way to communicate planetary health to your students. And hopefully, as they grow up, they will be very concerned about planetary health problems. And they probably will even plan to pursue careers in planetary health.
Wow. Thank you, Dr. Ginto, for that. Actually, one of my highlights is that when you say lahat, and I'm really, wow, it's really lahat in terms of planetary health. So thank you for sharing that. And
Quick note, no, I love the Filipino language. You know, I speak
yeah,
English and probably, oh, you know, he already has the Harvardian accent. Pero Tagalog na Tagalog ako, laking Laguna ako eh. At you know, the Filipino language is so rich, you know, and so beautiful to listen to. Kalikasan, kalusugan, right? And so I think that's also an encouragement to our teachers, especially the Filipino teachers listening. Help me translate these ideas to Filipino and and even to all the dialects of our country and the other languages of our country. I think that's the beginning of shared planetary health understanding.
Yeah, thank you so much for that. And yes, we have a lot of teachers or educators viewing right now. So, hello to everyone, to all the teachers and educators. Okay, so also a question here. You mentioned about the planetary health diet, right? So, um, someone asked, it's interesting, but should it be organic?
Yes, it should be organic and it should be low carbon and it should be less resource intensive and it should be nutritious and healthy. And that is why in the planetary health diet, so all those points have already been taken into account. And the plate that they ended up designing is a plate where half of the plate is greens and vegetables and fruits, right? And yes, it is indeed interesting. It is important to start considering the planetary health diet, shifting from meat-based to plant-based. But that the big challenge is how to do it because
Mm,
we know our passion for lechon and adobo, which are all meat-based dishes. And some gyupsals have been very popular in the country. I love some gyupsals once in a while as well. So it's a conversation that need to happen, and really ultimately that solution is not technological, but it's also cultural.
mm. Yes. Okay. Thank you. Thank you for that, Dr. Ginto. So this one, our next question is with a statement and a question as well. So it's kind of long. So I'm gonna read it. Okay. Since planetary health is entwined with virtually everything and the entire world is both contributing and affected by it, how does one persuade countries, especially those a billion in population, to participate and adhere to commitments supposedly made in such agreements? Especially when we know that it does happen. So there are world agreements made and countries are supposedly signatories to it. Yet, at the end of the day, certain countries just go on their way. So ignoring the environment and are not even held accountable for their transgressions, all because they are powerful. So that's
Great question. And really, political and social change are not easy matters, right? We always say that, these elite, high level, in the Philippines, we'll say nose bleeding research, no? Very quantitative, they're difficult. Actually, the more difficult part is the translation of evidence to action. And that will require, political engagement by scientists ourselves, right? To be politically savvy and to know how to talk to a politician, right? And that's why
mm,
communication is so important. But I think the ultimate answer is we need a very strong and empowered civil society, our public, our communities. They're the ones who should be demanding those who we elect into power to really adopt the planetary health mindset, the concept, and make sure it manifests in the policies that they pass and the programs that they implement. And so, really, I hope these kinds of webinars that we have contribute to the deepening of the people's consciousness. And hopefully, my encouragement and my invitation is after this webinar, what are we all going to do? Will this just be another webinar that we've attended for the past 3 months? I know we're already having webinar fatigue because of so many webinars, but maybe it's time now to really act together and have conversations, even within the dinner table, about planetary health and our future.
yes. Thank you so much for that question. Okay, so yeah, we'll be having two more questions. So let's have the second to the last question. So it's very practical. From our viewer, please share three simple things, like practical things that we should do to help our planet healthy. So maybe just very practical ones.
Right. Great. And uh, obviously I don't answer by just giving what are the three things, right? I want to acknowledge that one as the assumption of the question is that a lot of the ideas here sound impractical, right? Or at least ambitious, abstract, big. Because really what we need are structural changes, right? And systematic change. I think it's time to, individual behaviors are important. And if 2 billion, 3 billion people do change their behavior, then that will create societal change. But there is also, what they call in psychology, bounded rationality. That there are only limits to what you can do as individuals, what you can conceive in your mind. And you need the structure, the environment, the policies to change as well. It takes two to tango, the individual and the society. So, I would say one really is advocacy. To be part of advocacy for bigger societal change, right? Okay. Number two, of course, the more practical ones pertain to waste management, right? Recycling, minimization, of waste. If we think there are things that we don't really need in life, maybe it's time to forego, right? Or change our diets. You've heard about the planetary health diet. You don't need to to totally change into it overnight, right? Maybe gradual. And also energy consumption, for example, right? Because yes, we can change our energy sources from coal, fossil fuels to wind and solar. But we also need to make sure we reduce our overall consumption to not overburden our energy systems. So, you know, natural lighting when we don't really need, and actually now in my room, I don't have an open light bulb because my windows give me really good lighting, natural lighting. So I'll stop there. Thank you.
Okay, thank you so much. And lastly, is there a national movement already to promote planetary health and maybe how we can be part of it?
Right. I think there's already a national movement for health. There's already a national movement for environmental protection, and there's they've been existing for some time. But there's also this new community that we are building, planetary health, which is at the nexus, right, at the intersection. So feel free to send me a tweet or add me in LinkedIn, and then let's have the conversation, and you can be part of our circle. You saw a while ago our screenshot of the first webinar we had. We hope to increase the tribe in the weeks and months to come. So I'm inviting you to join Planetary Health Philippines. Thank you.
Yeah, thank you so much, Dr. Ginto. And so, for those questions that we weren't able to address, don't worry, we are taking notes of those things and then we will answer it. We will let Dr. Ginto answer it and we will send it via email. So, don't also forget to give us your email. Okay, that's it. So, now I'm gonna turn over this to Mom Pepper. Thank you.
Thank you, Jessica, and of course, thank you, Dr. Ginto, and of course also to our audience for sending in their questions. Definitely, we should improve. We should continue improving our health while simultaneously considering the changes that occur in our planet. Now, to officially close our program this morning, may I invite Dr. Myra Uruga, Assistant to the Vice Chancellor for Research and Publications Committee.
Thank you, Pepper. In behalf of the Office of the Vice Chancellor for Academic Affairs, our head, Dr. Melinda Dumanta, the Faculty of Management and Development Studies, Dean Dr. Primo Garcia, I am Dr. Myra Uruga. Would like to thank Dr. Renzo Ginto for giving us his precious time in sharing with us what planetary health is. Let me give you a very brief synthesis because I am given only 1 minute to wrap up this webinar. According to him, the planetary health as a new research frontier is a timely and relevant in this 21st century. It is provocative, exciting, really, and it's an emerging inquiry and action. Okay, Dr. Ginto related to us so many information, but what struck me is the theory of change. As a health promotion and education expert, I am deeply rooted to other theory of change, but he introduced a theory of change variables that we have to look upon also, which is the three dichotomous call, think and do, think, and for people and planet, and its relationship to COVID-19, infectious diseases, and other areas that influence in the environment. Okay, he briefly introduced the history of the relationship of health in various factors, as well as he also mentioned challenges, okay, on planetary health, the conceptual and empathy failures, imagination challenges, knowledge failures, and implementation failures. We are also given the think tank of reframing our minds that economy should respect the ecosystem. Okay, the climate hotspots. The Philippines is a climate hotspots also. Okay, as an ending to that, okay, he mentioned that the devotion to the systems, we have to think of the devotion to the system, deep concern to health of both people, and our commitment to this planetary health in relation to climate change. Okay, again, I'd like to thank Dr. Ginto for a very informative webinar. And I'd like also to invite you once again on June 30, we have another webinar. The speaker will be Dr. Florendo Lauro from Singapore. It will be an exciting topic again. This will be co-collaborated by the Faculty of Education. Again, I'd like to thank you for attending this webinar series. In behalf of the of UP Open University, I am Dr. Myra Uruga. Have a good lunch. Good day to everyone.